Go ahead, Stephen.
Morning, everyone. This is the February 14th, 2022 meeting of the Incarceration Prevention and Reduction Task Force. I will start with the land acknowledgement statement. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo peoples who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. We'll call the meeting formally to order. And we have several new members, I hope, to introduce. I see Blaine City Council member Ryan Lopez. Ryan, good morning and welcome to the IPRTF.
Morning, everyone. Like I said, I'm Ryan Lopez from City of Blaine City Council. Thank you for having me.
Ryan, you want to say a little bit more about your interest in the task force or what drew you to take part?
Yeah, absolutely. So when we elected our mayor, Mary Lou Stewart, one of her first assignments is to find out who can or who's willing to sit on various boards in the county on the city level. I immediately went to her with this task force in mind, and this was my number one. And I was glad that I was able to bat a few other people away from it. This is a program I've known about for a few years now, and just reading about it, it gets me excited. It's one of those committees that countywide does a lot in the community. It's something that me personally, I wish was in existence 20 to 30 years ago. I know it would have changed my life for the better. And I know many of my family and friends that have struggled with family members that had criminal backgrounds or drug addiction or abuse or anything like that would have benefited from some sort of program like GRACE, for example, would have helped out a lot of people that we're familiar with. So I was super excited to get involved in just reading about the successes of the program. I want to do everything I can to contribute and continue to make it a success, as well as tie everything back into the city of Blaine, learn as much as possible, and do what I can to bring it back to our city council and hopefully improve Blaine for the better.
Thank you, Ryan. I can say that Jack and I met with Ryan last week, and Ryan was asking the kinds of questions that were deep enough that they would gratify even the wonkiest among us with his knowledge of the work to date of the task force. So Ryan, welcome. I think you're going to be a great addition. We also had recent appointments from Jen Lockwood, who's the Associate Executive Director of Bridget Collins Family Center, and Jason McGill, who's the Executive Director of Northwest Youth Services. I didn't see them on the participants list yet. I know Jason was going to join about 9:30. We'll try to get an introduction from him, and I hope Jen can join us later as well. So welcome to all three of them. The next agenda item is confirming the committee sign up for 2022. Jill, you have a draft of that, I think, in the packet. Do you want to finalize that?
Yes, thank you. This is just an FYI for all of you to review your committee assignments if you'd like to make any changes, or if you'd like to assign someone to be your proxy, or if you have not yet signed up for a committee, please just email me and let me know how you'd like that to change for 2022. That's it. Thanks so much.
Okay, thank you, Jill. And let me go back to the introduction of new members. We're coming up to the second anniversary of functioning in this weird Zoom environment. And so it's far less interpersonal than meeting together in the same room. And just for the sake of letting Ryan and Jen and Jason get to know who they actually are interacting with on the screen, I know it's common for people to have their video off. If sometime during the meeting you could video on so they can see who we are, I think that might be nice. Thank you, everybody. And I see Jen has come on. So Jen, welcome to the IPRTF. We're glad to have you. And I wonder if you would just say a few words of what brought you here, to your interest in the task force, and what you're hoping to get out of your participation.
Sure, thanks. My apologies for being late. I had some hassle with children and school drop off this morning, so I got here as soon as I could. But so my name is Jen Lockwood. I recognize some of your faces, so it's nice to see some of you. I work at Bridget Collins Family Support Center as the Associate Executive Director. I'm also a licensed mental health counselor, and I'm trained in 5 evidence-based practices. Certainly over the 17 years that I've worked at Bridget Collins, I have interfaced with many people that have experienced incarceration or have been impacted by incarceration, family members and whatnot. And so as Byron, our executive director's time was ending on the committee, he asked me if that was something that I would be interested in participating in. And so absolutely I am. We recently, unfortunately, the pandemic hit. And so we've been operating in the context that the pandemic had received some funding to begin a program for reincarceration prevention for parents. And so I do have a staff person that is doing that work, and I do supervise her. And so it's exciting to get to be a part of this committee and be a part of the work. So anyway, that's me. Thank you for giving me the opportunity.
Thanks, Jen, and welcome aboard. Next agenda item is a discussion / update on the state legislative session. We asked to have this on the agenda as of course, the old timers recall, we've been discussing state criminal justice reform since the last session, and the package of bills that came down all of a sudden and were quite controversial. There have been a number of bills trying to deal also with the behavioral health system, competency evaluations and restoration. My hope was to pull together Sheriff Alfo, Caleb Erickson, Prosecutor Ritchie, and maybe Jackie Mitchell and Perry Mowry from the health department. Very few of them are able to attend today's meeting. Eric is driving back, he said, from being on vacation. Sheriff Alfo had at least a double booking, if not a triple booking. Caleb was not able to be here, but Perry, I think, is here. Caleb's here. Hi, Caleb. Do you want to start? Because I know there are a number of bills, and I'm not really tracking them, but the numbers I have are SHB 1735 and SHB 2037, which deal with use of force stuff. And I think there's also an SB 5663 that tries to respond to the Blake decision on drug offenses. And Maya, I want to invite you to join in here also, because I'm sure you're tracking a lot of these as well. Caleb, why don't you take it away?
Oh, excellent. I had to step out for a quick second and wasn't tracking all that was leading up to this. So I am not in any way prepared to address any of the things that you just mentioned, Stephen. Sorry about that.
That's okay. Perfectly fine. Maya, you have any sense of these bills?
No, I don't. I can't really address that right now either. Sorry, not prepared to do that.
Okay.
Stephen, this is Jack. Why don't we share the sheriff's comments? I could maybe read those that he wrote in.
Yeah, I have them too, but
Oh,
go
you have
ahead, Jack.
Oh,
Yeah.
okay, as long as one of us did. So Sheriff Elfo sent his regrets and said he might not be able to be here, but did want to communicate that he is tracking and supporting proposed amendments to previous reform legislation, particularly those that there are 6 points. One, he supports the portions of bills that reauthorize officers to temporarily detain persons for which reasonable suspicion to believe a crime has or is about to be committed, and to temporarily detain the person for the purposes of investigation. That would be restoring the Terry stops. Also, to allow pat downs for dangerous weapons if reasonable suspicions exist to believe a person is armed during a Terry stop. To authorize, again, vehicular pursuit subject to the current balancing test and safety considerations based on reasonable suspicion to believe a crime has been committed, and to expand the crimes for which vehicular pursuits are authorized, or in the alternative, permit for any violent crime and residential burglary. And he had a personal note: I've known too many cases where people have been seriously assaulted or even murdered when coming across an intruder in their home, and other vulnerable people are sometimes so traumatized after an invasion of the safety of their homes, they're afraid to live there. It's a serious crime. Also, to clearly articulate the circumstances when an officer is allowed to use necessary and reasonable force to take people into custody for involuntary mental health evaluations or subject to court orders, as well as when necessary for protection of children. And finally, he supports providing a clear and consistent definition of physical force. So those were the sheriff's priorities with the amendments that are going through the legislature that he'd like to see, that he supports and would like to see in place.
So I don't know, this is causing me to question the wisdom of trying to track mid-session some of these bills, because as you know, a lot of this is in flux. These are really complicated issues that have a lot of opinions floating around for them. So we'll try to check back next month and see if some definition has started to take shape on the proposals that are actually still alive, and we'll check back with you. Perry, I'm wondering if you have something you want to talk about on the behavioral health arena.
Yes, certainly. Good morning. Perry Mowry, Human Services Supervisor with the Health Department. I see that Maya has her hand up, and it may be related to the past information.
Yeah, I think so too. Yep.
Maya, you want to go ahead?
Sorry, it is. I mean, I wasn't prepared to talk about this or present on it today, but I mean, if I don't know if you're looking for, I mean, like there's a House bill that will end solitary confinement in Washington, and we support that, and maybe people should know about that. There's a House bill that would prevent juvenile dispositions from being counted in adult felony court. I think people should support that and write to their representatives. I don't know if that's the kind of thing you're looking for.
Yeah, I think so. I think so, Maya. I don't think we're looking necessarily for consensus, for example, on all the sheriff's points, but I think what we're trying to communicate is where the members of the task force and the people who are stakeholders here have their interests. And I think it would probably be appropriate that different people may even support different things. But I think, Stephen, wasn't the purpose to track what's in the legislature, and then alert the members of the task force that want to support, or I suppose not support certain things, to know what's going on. I think that's the goal here. Is that?
I guess,
I agree.
Yeah, I mean, like there's also like bench warrants were suspended and the court rules were changed to allow people to have appearance through their counsel, and there's some movement to try to change that back to what it was before, and we're very opposed to that. I mean, I guess there's lots of emails with legislative updates and stuff. I mean, I mean, I guess I just, yeah, I don't know. Maybe this is the right forum for it, but it's like, I don't know. I think this could be a whole different thing, like talking about what's brewing and coming up in the legislature. I don't know. Thanks.
Well, maybe we will get back to you to try to frame a more informative approach to this next month's meeting.
Yeah, and I think to clarify for everyone, we're not, in my understanding with Stephen and I, we're not trying to find a consensus or have a vote or an opinion of the task force. We're just trying to make people aware of things that could pertain to the task force's actions and things that might be relevant. And that's really the scope of this. And thank you, Maya, for, I didn't know about that juvenile one. I want to support that. All right. I
I
think
can send some stuff to Jill if that would be helpful for if people want, because right now it is important to make your voice heard. If people want that, I can send stuff to Jill to forward.
Yeah, that would be great. And I endorse Jack's very articulate statement of the purpose of this discussion. It's really just to try to keep us abreast of things that have tentacles back into earlier discussions or that might affect things we're talking about in the coming months. And before we go to you in behavioral health, I see Caleb has his hand up also. Caleb, go ahead.
Yes, sorry about that. I as things were coming together here for me and listening to Maya speak, I believe I heard in the index committee meeting that there is a proposal in the legislature that would change the definition of, or I guess the term for which juvenile matters are dealt with in juvenile court versus in adult court. So bumping the age up to, I believe, 19. And so I think that's going through right now. So it would go from 18 to from when they turn 17 being the last age to 19 being the last age. So 2 full years. That's my understanding. So that could have an impact here.
Great, thank you for that, Caleb. Okay, Perry, what do you have to share?
Yes, the bills that I've been following are behavioral health related, and of course that can spread across a number of arenas. By no way, shape, or form is this an exhaustive list. It was, as I began to put it together, I wasn't sure about the time frame and so forth, so that's how I oriented myself. One of the ones that was already mentioned and is certainly important is House Bill 1735. It makes changes, or is attempting to make changes to last year's House Bill 1310 to allow for use of force by peace officers under certain circumstances. And from at least my perspective, including transporting a person for evaluation and treatment, where there were some real challenges with that. So hopefully there's some insight there into the needs and issues that we've been experiencing just relative to involuntary treatment admits and evaluations and that sort of thing. House Bill 1865 really has to do with the workforce gap, really paying a lot of attention to that, struggling with those kinds of things. It essentially establishes a certified peer specialists and certified peer specialist trainees as a new profession, and sort of frames that component up. We're seeing a lot of suggestions, recommendations by a variety of teams, relative to enhancing some of the behavioral health gaps that we're experiencing as far as professionals. And so that's something to pay attention to. I think I've shared before that I'm always cautious about considering using individuals with maybe less education, less training, less experience, particularly in more challenging individuals. But I think that with the right supervision, the right support, that the certified peer specialists and is really a great possibility. So hopefully we'll see something continue with that. In addition to the workforce gap, House Bill 2040 is an act that is essentially streamlining the licensing requirements. So they're really looking at that. 2040 has to do specifically with licensed social workers and licensed advanced social workers to essentially bring more of those individuals into the workforce with a little bit less stringent requirements. But the supervision and support certainly continues. So that's something that I think is important and that we're, continuing to pay attention to. A little bit away from that, but something that's pretty similar. Senate Bill 5644 establishes a plan to create standards and training curriculum for co-responder teams. We have talked about this a little bit, and oftentimes the discussions that I get into with first responders and law enforcement is true concern for those non-law enforcement professionals as co-responders, and the risk that they could potentially be in and responding to calls and those sorts of things, which I personally believe is warranted. And so what's happening is I know that there are some specific teams and groups that are working together to basically put together a standardized curriculum and a training plan for those individuals, which I think is a really good idea, because then we know what the individual has been trained to and maybe what gaps there continue to need to be. Jack and Stephen made reference to this Senate Bill 5655 requiring state hospitals to establish the capacity to provide short-term detention and civil commitment services for persons who are experiencing difficulties being admitted to community facilities. So that's obviously an important one. A capacity issue exists, and there continue to be a lot of challenges there. And finally, I'll wrap up with Senate Bill 5884. It requires Department of Health to create a certification for behavioral health support specialists. Again, another framework of further developing the process for addressing the gap that we have in workforce. These individuals would at least have a bachelor's degree and then would practice in partnership with licensed behavioral health professionals. So that's been predominantly my orientation towards, watching the House bills and Senate bills. And I have, obviously the bills themselves. I can forward those to Jill, and I'm certainly willing to offer an update during our next meeting. That's the information that I have.
Thank you very much, Perry. And Councilmember Hamel, your hand is up.
Yeah, thanks for recognizing me. Dan Hamel, Bellingham City Council, Ward 3 representative. I think that we need to be a little more strategic when it comes to our lobbying efforts out of this task force. We've got this is the short session right now, and we're not quite halfway through, but halfway through. I want to get a strategy for the long session for next year in terms of our priorities, especially around behavioral health issues. Perry rattled off a few of those, and I think that we're going the ledge is going in the right direction. I think mostly to correct some of the things that have been going on last year, but I don't know how we do that. I don't know how we formalize. I don't think we need another committee, and perhaps that can come out of our own committees that we chair and serve on, in terms of what we recognize as being priorities. I mean, really, that's what it comes down to. They're just goals that we're recognizing. We're seeing stuff on the street that's, in behavioral health, we're seeing carfentanil like we've never seen it before. We're seeing the phenylpropanol meth like we haven't seen. So what do we do to effectively address those at the legislative level? And anyway, I'm throwing that out there. I'll probably bring these things up with Parker in the Behavioral Health Committee and see what the appetite is with the members and the new members.
Great. Thank you, Dan. Okay, Jack, over to you.
Okay, so I'm assuming we just concluded the legislative discussion, correct, Steve? Okay, you're muted, but
yes, I think we did.
Okay, great. All right. Seeing no more discussion on that, we're moving to the Justice Project Needs Assessment, and I'm going to turn that over to Barry, who is the new. Is this where we announce, Barry, that you're the chair of SAC?
That'd be great, I guess. Yeah.
All right. Barry has graciously, amongst all the other hats he wears, agreed to accept the chairperson of the Stakeholder Advisory Committee relating to the Justice Project, and will be reporting to us in that capacity amongst his other roles. Thank you, Barry.
Thanks, Jack. And thanks, everybody, for being here this morning. And first of all, I'd like to welcome our new members. While I give this update, I also want to give you just a quick history so our new members kind of have an idea what we're talking about here. Back at the end of 2017, when the second ballot initiative for replacement correctional facility had failed, the council went out and did a listening tour in early 2018 up through probably midsummer. We went to 7 locations and we got a lot of input from all around the county. And we that led to a lot of work on some of the major planning principles that the council really wanted to see go in to when we're planning for a new correctional facility. And part of that during those listening tours, what we found is that the community at large, everywhere we went, was more interested in treatment than punishment and wanted to really have that as kind of a guiding principle. So the council had a resolution that we did, which was the planning principles. One of the things that came out of the planning principles is that we wanted to engage our community more, because that was something that we really fell short on in the first 2 initiatives that we ran in 2015 and 2017. So we put together a county advisory group called the Stakeholder Advisory Committee. That's what SAC stands for. And not to be confused with the Strategic Air Command, which is, being an ex-veteran here, I'm always making that mistake. Anyway, so the SAC was created in 2019. By the end of 2019, they were all the appointments were made. It's a large group. It's about 20 or about 30 some folks that will be putting together a needs assessment. We started that work in 2020, and guess what happened? We had COVID shut down. Our first meeting was scheduled for March of 2020, didn't happen. Therefore, we went into almost a 2-year hiatus on the project because we just couldn't get together and meet the way we wanted to. So as we started clawing out of kind of the emergent things with COVID, we started wanting to put this project back together. So we reinitiated the process. We verified the SAC members' interest, and we actually had our first meeting on January 20th. It was mostly an informative meeting to get everybody kind of up to speed what was going on, kind of this history. Deputy Executive Schroeder presented kind of the strategy and the history of the project from kind of the inception. The sheriff and Prosecutor Ritchie went over a lot of the stuff we talked about today with legislation that's affecting law enforcement that changes kind of the landscape of what we're dealing with here in Whatcom County. So we had that presentation. Then myself and Stephen gave kind of an overview of the SAC process and what we're doing. It was a 2-hour meeting, and everybody it was facilitated by Crossroads. Everybody came away, I think, feeling there was a lot of information exchanged. It was a basic fire hose on that first day, but we wanted to get as much out to folks as we could. Which brings us to the kind of the next piece of the discussion was how we integrate this work into the task force structure. The council back in end of 2021 had put forward a motion to put this work onto the work plan for the IPTRF for 2021 and possibly some of 2020 or 2022 and maybe some of 2023. So that's what we're here talking about today. What we found is that there's going to be a profound interest in having some more detailed meetings other than just our main stakeholder advisory committee meetings. We thought of some ideas on how to do that. And one of the ideas that we floated at our steering committee was how to use our subcommittee structure. Because one of the things that we did with the SAC is we put out a survey with many questions about their interest and their ideas about the project. But one of the questions was, of these subcommittees, which of these are you interested in? So that survey closed on Friday. So we do have that. We'll be able to compile those results probably today and find out who's interested in what. And we thought of trying to find a way to integrate those folks that are interested, say, in behavioral health into the behavioral health subcommittee somehow and be able to exchange ideas with that already existing meeting structure we have. So we wouldn't have to completely reinvent the wheel. We had a number of suggestions that went that we had, and I'll just hit a few of the highlights. Having the subcommittee chairs meet individually with these new folks that are coming on from the SAC and get them up to speed. Having the SAC members join our subcommittee meetings during the regular agendas. These are things that are going to be worked out within your subcommittees. We're not trying to dictate any of these. These were just ideas that we were brainstorming at our steering committee meeting. But we just thought there was a lot of value in using a structure that already existed rather than, like I said, reinventing the wheel. Our second meeting is going to be revolving around data in the criminal justice system. What we did is we formed a data team that's being led by Dr. Alexis Harris from the University of Washington. You might remember she presented to the task force back in September and gave us kind of an overview on some of her takes on criminal justice data. So she is leading a team of her, Caleb, Wendy. We have someone from the Administrative Office of Courts. We have Darlene's going to join, myself and Stephen. And so that work starts tomorrow morning. We're going to start looking at what kind of data we think we need to look at and how we need to integrate it into this process of doing a needs assessment. Because data is critical, as we all know. We've all struggled with kind of that data question of, what data do we have? What data do we not have? What data do we not even know that we need? So there's just a lot of questions around that we want to try to get ironed out. Our third meeting will be about behavioral health, and we'll be looking at inventory of our programs and some of the gaps and do a gap analysis to find out where we could further reduce, our incarcerated population through our behavioral health programs, and of course other diversion programs as well will enter in. We've also going to have that data meeting. We'll have someone from Grace and Jeremy Morton from EMS is going to be joining that team. He's the data guy for EMS. So it's a strong team, I think, for that second meeting. And tomorrow we'll begin really trying to cement the plan for that agenda for meeting 2. So I could go on and on and on, but I think I'll stop there. And if you have any questions, I'd be happy to answer.
Thanks so much, Barry. Are there any questions for Barry? Dan.
Yeah. So we've already had one member of the SAC publish a letter to the editor in the Cascadia Daily News. It was not a controversial letter, but we're trying to thread the needle here on something that's failed twice in this community. And I think there needs to be a little bit better message control when it comes to what we're saying and what we're saying publicly. So that's just a thought. And then the other piece is that the members, this is a 35-member, commission or board or whatever we're calling it. I think that those members need to go to the subcommittee meetings. I don't know if the task force is the appropriate venue, but the work gets done in the subcommittee meetings. And I think that those members need to be present so they can get caught up. A lot of these folks have very limited, and I know not everybody, but a lot of the folks there. And I'm just questioning the knowledge base. We're talking about an initiative that's going to be up next November. And so the clock is ticking. And I think that we've got to get folks up to speed when it comes to just creating their own base of knowledge. These are complicated matters. They're in flux. They're changing constantly. So that's my 2 cents.
And I totally agree with you, Dan. And on your first point, as far as our messaging, our communication specialists should be on board next month to help us funnel, to figure out how we're going to craft our communications plan and where we have better single points of contact, maybe so we can have a message that's consistent. And I totally agree. I think it's a great plan to have the subcommittees help take on that work and inform the SAC members, because there is a big knowledge gap between, say, all of us and just new folks coming on board in a volunteer situation. So I agree.
And Dan, quickly on that letter, to some extent, I think the system's working because I spoke with, you're referring to the letter from Atul?
That's correct.
Yeah. He and I spoke at length because he wanted to gather information. And I think the communication he sent just sort of framed a little bit what we're doing. And I know he was trying to, we've been asked to reach out into the community as different members. I also referred him to you, which he said he knew you well and would do that. So I think to some extent, I don't know how coordinated we'll be able to be to some extent as people take on the various communication mediums they perceive to be useful for them. But I was kind of pleased with the dissemination of information because just as you said, it was just letting people know what's going on, generating interest, and hopefully that continues. But being on that SAC leadership team, your point of trying to have more comprehensive, maybe a strategy about that, Jill's going to talk later today about even our communication, but we'll certainly bear that in mind. But I was actually kind of happy to see that letter. He and I had a very long and good conversation. And it was great to see someone that interested in the issues.
Yeah, duly noted. I guess my point is that that letter could have been anything. It was not controversial, but what we're talking about is one of the biggest investments in Whatcom County's history. And I want to make sure that we're explaining to the constituents the values that we're showing in terms of treatment and intervention, which we're prioritizing.
Yeah.
And then there's 8 years of it that we've accumulated here by most of the members here, with the exception of the new folks. But I just want to have discipline when it comes to how we're discussing it.
Point well taken. And we can probably always do a better job of communicating once we figure out our values. I think we have a good sense of that for the most part, and then communicating that. Thank you. Really.
As Dan just mentioned, it's going to be one of the biggest investments that this county has ever undertaken, and I see the value, and I know that we need a new facilities. My concern is the sticker shock if we actually get this approved, is the expense of it. I just remember that I had construction done on my house that was needed, and I was so thankful that everything was done prior to all the prices of construction that's going up. Everything's going up in price. By the time we get to this, we pass this, or if we get it to the voters, are we going to be able to afford it as a county? Are the voters going to want to do this? And I think as much as we want to push this forward, we also have to take into consideration the rate of inflation right now and how that's going to affect people making this decision, because nobody wants to pay any more than they are right now.
Thank you, Renee. Beverly Wood.
Thank you. I'm part of a group that meets a couple times a month, the mayor's group, and I see Mayor Linden Scott Cortice is with us. I'm just wondering, Barry, if we've reached out to you. It'd be sort of a perfect opportunity to have you come and give a summary. We were talking in depth at just our last meeting about the jail. Anyway, Scott, opportunity, Barry, to come and chat to us sometime in the near future.
I'd be happy to. So.
Okay, great. Thank you.
Mayor Cordice.
Yes, so I agree. It's actually on our agenda for a brief update tomorrow from the sheriff as we meet as a small city caucus. But is it in terms of cost? I know it's going to be expensive, but it'll never be cheaper than today. And we have to realize that kicking the can down the road is no good anymore. And we've kicked this can way too many years down the road. And we could have done this 15 years ago and had probably a reasonable cost jail that would be doing us a good service today. So we need to have the appropriate facility for our community, but we have to, as leaders, we have to start selling the fact that we need it. There's no question we need it. And so in some respects, I'm disappointed we continue to study it when we know we have a need. But I'm willing to walk through the process, but there's no question that we need this. Very part of your, I'm on the stakeholder advisory group, but we do need this facility.
And Mayor Courthouse and Mayor Fleetwood, thank you for, this is one of the best things the task force does. So yeah, thanks for communicating that, inviting Barry there. One thing in our leadership thing we talked about, it seemed obvious that most, I won't say everyone, but most people agree the current facility is woefully deficient. People who have toured it understand that. While there may be disagreement on what the appropriate remedy is, there doesn't seem to be a whole lot of support for the concept that what we have is tenable, reasonable, or humane. So I think hopefully, Barry articulated what we thought in the SAC, that because we asked, like, do we need to do more tours? Do we need to do a video? I think it's fair to say that anyone that studied that issue knows what we have. Is it okay? And the differences seem to be more about what's the appropriate remedy than that we have a problem.
I think you hit it right on the head, Jack.
Okay. Anyone else? Okay. I think that concludes the discussion on Justice Project Needs Assessment. And now, Stephen, do you want to take the Grace and Lead transition to Health Department with you and Perry?
Sure, I think that's an easy task. I'm just going to ask Perry to hold forth.
You bet. Good morning again. Perry Maury, Human Services Supervisor with the Health Department. We are in the process in the Health Department. I guess I'll back out just a little bit and talk about the fact that steps are being taken to move the GRACE and LEAD programs. GRACE, for folks that are not aware, is ground level response and coordinated engagement. And the LEAD program is law enforcement assisted diversion. Both of them work very closely to address individuals that are high utilizers of services and or experiencing challenges within the judicial system that may be better supported and helped through a diversion program such as LEAD. So the programs we're working on at this point, moving them under county administration as a part of a new division within the Health Department. The name thus far has been the Response Systems Division. And the intent and purpose there is to house many of these types of programs and diversion related programs so that the communication, the proximity, the interaction is high end. Right now, the initial steps in terms of creating that response system division was to seek and approval for the response systems division manager position, which it was approved by the funding was approved by county council, and Melora Christensen has completed team interviews and was selected as a successful candidate for the new division manager. And so involved in that step, the second component of that process is to transition, was to establish positions within with County Human Services, and that process has actually been completed for those GRACE and LEAD team members. And so that process has been completed, and the expectation and hope is that all current GRACE and LEAD staff will transition to the county right around mid-March. So if I believe I have my numbers correct. For GRACE, that means one supervisor, which will be a new position because that is Melora Christensen's position currently. And also an advanced registered nurse practitioner and 5 intensive case managers. The LEAD program transition will include a supervisor, 4 case managers, and 1 outreach coordinator. There's also some expansion of LEAD that is in the future at this point, that is our recovery navigator program. That won't come in at this point, but it will in the near future. The focus of the transition continues to be ensuring consistent presence and services in the community, and with GRACE and LEAD clients, and to support staff in the move to county employment. The GRACE and LEAD staff will continue to be housed in their offices at 800 East Chestnut, And I spoke with Ms. Christensen and asked if she would actually like to do the presentation given her position and so forth. And she indicated that what she would like to pass along and that she would be more than happy to be available to offer updates and more detail, in regard to this transition if the task force wishes that. And that's the information that I have at this point.
Harry, I have two questions myself, and then I see Dan's hand up. Just organizationally, the prior structure for Grace and Lead were contracts were let to CMAR Community Health Center, and the staff were employees of CMAR, I guess. So largely what you're saying is their employment is being transferred to county employee status. Am I right in understanding that correctly?
Absolutely accurate. Some real challenges just in really any community behavioral health provider. You're aware. I know that that Grace is the design and purpose of Grace was to be a hub to work with those individuals, support those individuals, and then the spokes would include behavioral health agencies and a variety of supports that those individuals would then be supported through Grace staff to move out to. Well, interestingly enough, for example, CMAR being the current administration of that contract is actually a spoke at the same time as being that structural piece of the administration. And so there were limitations and challenges, sort of time frame things that were challenges as well. And so that was part of the decision. You're absolutely accurate, Stephen. That's the short version of what's happening and a little bit of why.
And my second question is following up on your report of the response systems division being created. Jill, I think last week, distributed to us an RFP for, I think from the ASO on unarmed response or co-responder systems. And I'm wondering if you have anything you can report on that and how that integrates with the new division.
Sure. So the intent in terms of the response systems division, again, is really to house the responses in general in the community, as well as obviously the diversion practices, to have those in as close proximity as possible in terms of communication and utilization and support from each other. And so at this point, it hasn't been finalized, but there are other components in that response systems division that would include, for example, mental health court. Given that it is a diversion program and often, is very much involved with the Grace team and the lead team, for example. There's also others that we had talked about as a group, and one of those components was, you're correct, Stephen, that the Behavioral Health Administrative Services Organization receives funds from the state that are directly oriented towards related crisis response services. And one of the sets of funds that they do have is for crisis response specifically. And so we reached out to and communicated with the Behavioral Health Administrative Services Organization just relative to funds that were set aside for a co-responder model in connection to the sheriff's office. And some communication had been occurring prior to our discussion with the BHASO with a behavioral health provider in the community that has some co-responder models that are actually implemented in other nearby counties. I'll stay general at this point just because of the nature of sort of where we're going. And what we wanted to do is we wanted to look at our options as a county of programs that we would be considering and utilizing, and also how that might fit into the process of the new response systems division. And so that is what, when we approached the BHASO in that regard, and had this discussion. They indicated that behavioral health agencies had approached them in this regard, and that there would need to be a process of procurement that went on because of that process. And so we fully supported that and have been in pretty close communication. As you mentioned, the RFP, I think it was RFQ, was released, and so we'll be responding to that. Haven't talked with my upper structure yet. I suspect I'll be responding to that. So so we're looking forward to taking a look at that and looking at our best possible options in that regard. And again, the connectivity in terms of the response systems that are going on in the county.
Thank you, Perry. Dan.
Yeah, this is absolutely the right direction, I think. So for Ryan and Jen, and I see Jason just jumped on the call here. So Dan Hamill, Bellingham City Council. I was the lead person, the lead policymaker from the city for both the LEAD program and the GRACE program. I'm the council member that initiated the alternate response team concept in the behavioral health subcommittee back in March of 2020, which seems like a different lifetime ago because of COVID. And so things have stalled a little bit, but that it's going in the right direction for these programs. And I'm definitely supportive of the programs living in county government versus a nonprofit like they have for the past several years. I think that government employees make more money, that they have better benefit packages, they have retirement. You're just not going to see that at some of the nonprofits that we have here. And that's not a slam on them. That's just the reality of it. I think the ART does need to go to the county, and whether or not it's a behavioral health specialist paired with an EMTB or paired with a nurse or some kind of medical professional, I think that's got to happen. A lot of the folks that we're seeing when we did the analysis of the call types back about a year ago had comorbidities as well as the behavioral health issues. They also had a physical issue, not all of them, but many of them. And so if we can address those issues and really work with the whole person, I think we're just gonna have better outcomes when it comes to patient success stories. So I'm very supportive of this direction. I will continue to lobby for whatever I can do to help expand this program and make it resilient. Just wanted to pipe in there.
Thank you, Dan. Other comments on Perry's report about response systems and the GRACE and LEAD programs? Okay, I'd like to sort of interrupt the flow of the agenda for just a moment. And as Perry noted, I'd like to acknowledge that our third new member to the task force, Jason McGill, Executive Director of the Northwest Youth Services, has joined us. Jason had a prior meeting that he had to finish up. Jason, welcome. Wanted to know if you wanted to introduce yourself a little bit and talk about your particular interests with the task force and reasons for joining it, what you'd like to accomplish.
Yeah, thank you. Yeah, I apologize for being late. As Stephen mentioned, I was in another meeting I had to attend. But I'm just really happy that I was voted in as a new member for this task force. I think it's a really critical task force to be involved with in our community. And, there's many things that you all are already doing that has been really impactful for community members. But just for me, I'm, again, as Stephen mentioned, I'm the Executive Director of Northwest Youth Services, and pronouns he, him. And I wanted to join this just to really have another voice at the table that are ensuring that we're not criminalizing homelessness and just targeting and othering those folks. So yeah, there's many others as well, but in particular, that's one of the primary reasons why I wanted to join. So, and we have staff who are heavily involved in the jail system here, just going in there daily and working with serving young people, and just want to make sure that they also have the resources even while they're in there, as well as when they exit. So yeah, that's all.
Great. Thank you, Jason. And we're excited to have you, as well as Jen and Ryan joining us. I think the range of backgrounds and skill sets that you all bring will be really important to us. So Jack, I lost track of our.
Oh, no, we're good. And
structure.
Jed Holmes has joined us, so we're ready to go to that, I think. The only thing I wanted to add, though, one of the reasons, since we have the new task force members, Stephen and I invited a meeting with them and asked them to share their areas of expertise, is we feel a lot of the value of this task force has been different people coming together representing different things. Like if you didn't know that, you know, what Mike did or Maya did or Jen did, it's harder to know who the experts are in that area. So thanks for your indulgence in that. And that's why we did it. Jill, yeah, go ahead.
Thank you, Jack. Since we're welcoming our new members, I just wanted to remind you as well, in your meeting packet for today, there is a list of the task force committees. If any of you would like to join one of those committees or designate a proxy to attend on your behalf, just send me an email and let me know. Thanks.
Okay. And Stephen, we do also, after the discussion with Jed on GARE, Jill has a couple minutes on task force communication that I'd like to insert before the committee updates. So,
Great.
Okay. I think with that, we've asked, those of you that don't know Jed Holmes, are you the county communications manager? I think is your title. I know what you do, I think, but we've asked him to come in and talk about the county's implementation of the GARE membership.
Good morning. Thank you everyone for inviting me here this morning. Yeah, I could start with this. About a year or so ago, actually I shouldn't quote dates because time's a blur, but the Public Health Advisory Board recommended, as part of its recognition that racism is a public health crisis, recommended that the county explore Government Alliance for Race and Equity, which is a coalition of governments kind of under an umbrella organization that helps local governments explore, think about, develop tools and implement plans that address racial equity as it's expressed in government, largely internally, organizationally, but also in its interactions with folks in the community. So it's kind of a steps toward this. Maybe about a year ago, a group of county folks, kind of with the help of the facilitation of the health department, we started talking about how this might fit for, what's the fit for county government, and how do we address race issues in general, and then specifically how we're going to use the GARE program, the GARE framework, and make that work and use those to, to take some steps forward here. And just kind of a few comments. The county government it's a difficult structure to work with because it's maybe like 20 different organizations with a lot of different cultures that vary depending on what department you work in. And so it presents quite a few challenges, and how do you deal with this? And so we spent a couple months meeting, probably I think twice a month, with some of our local elected leaders, as well as department heads, trying to figure out how do we address this? How do we figure out, get everyone engaged who's interested, and also not leave people behind who don't think that racism or racial justice issues are something that should be the focus of county government. And then last summer, we put in our application, and we've been working toward, it's called a roadmap that kind of helps guide us through adopting the practice of GARE. Unfortunately, we've also faced challenges with personnel and folks coming and going. And I know many of you know Astrid Newell. She had been the driving force behind this, but she's now moved on to work for the State Department of Health. And so I've been tasked with moving this forward, and hopefully in the next couple months, we're going to hire someone else in the executive's office who will also be maybe a higher level of expertise to address these issues. Not sure, you had some specific questions. Jill, do you have those questions you had for me?
I didn't have any particular questions from the task force members. I think one of the questions on the agenda was how can the IPRTF help with implementation?
Yeah, well, it's a little bit difficult, and that's kind of, yeah. We haven't gotten far enough into the implementation, the adoption of the recommendations to actually have a good answer to that. It is mainly for folks that are working within government and within government structures and how that works internally. There's not a lot of that sort of community government interconnection, but there's a lot of recommendations, for example, maybe on how committees can be structured to make sure that the outreach that we do to the public, how that we make sure that there's not gaps that are related to racial equity and all that. I think the first kind of step that we're doing is we're going to implement a racial equity employee survey that kind of gives us a snapshot of what county employees think broadly and specifically kind of by department. And then we're going to move forward to a racial equity plan, implementation that, and then accountability with probably annual reports on diversity, equity, and inclusion. So that's the general scope. Unfortunately, because of, I guess, just workload concerns and issues, we haven't been able to move as quickly on that as we'd like. So that's.
Jed, two questions, and I'm cementing my reputation for packing multiple questions into one screenshot. First off, the task force some time ago adopted the racial equity toolkit from GARE as a policy making guide for our decision making. That's sort of a prepackaged thing. It's comprehensive. It engages with the community, and it's ready to go off the shelf. Is there some thought that departments or the council or any part of county government might implement that in their decision making and policy making sooner rather than later, or are we going to go through the multi-step process you just laid out?
Yeah, we are looking at that, right? And I think we have folks that are becoming more fluent in those toolkits and how they can be applied. I mean, certainly we haven't made the investment yet of time and effort to broadly, I guess, adopt those yet. But that's on the agenda, and we're trying to see how to do that in a way that works well. So.
And the second part of my question is one of the concerns that came up was there are a number of resources and training opportunities and so forth that go along with GARE membership. Is that something that the task force and its members could take advantage of now as we develop our sense of implementing race equity change also?
Yeah, unfortunately, GARE is a very government-centered. And so like as a government entity, we applied, and anyone who works in Whatcom County government and has a Whatcom County email address can participate as part of kind of become a member, so to speak, in the system. But it's not a community tool. I know that the racial, we're having the development process with the Racial Equity Commission, and I'm sure that they're going to address maybe some of those gaps that come between what we look at internally and kind of where we need to build those bridges and if in terms of training, for example, yeah, I think that's probably going to help happen elsewhere, and there will be opportunities for this task force. Further questions, Dan?
Yeah, I guess I'm a little frustrated and slightly confused as to implementation of the GARE toolkit. This was something that we had talked about for a long time. Parker, I don't see him on the call anymore. He brought it forward under the Behavioral Health Committee, and I have yet to see how this is being used either at the task force level or even in our subcommittee meetings. We don't use that lens. There's 6 components to the GARE racial equity toolkit, and it has basically it's a way to create policy that makes sure that's equitable and fair, and it addresses racism as a real thing that we have to deal with. And I just don't understand how this is being applied at the task force level. I don't understand how it's going to work at the county level. I would love to see the city council to adopt that, but to really use it, to not just it's like lip service to me that we say that we want to do these really good things, and then we don't. We have not used the toolkit at all, as far as I can tell. And so I want to understand from the chairs, if it's being used, am I missing something here, or what's going on? Because I just don't see it.
Dan, I happen to agree with you that it's something that we've said we've adopted, but we haven't really implemented or made use of in any sort of formal way at all. I would suggest to Barry that maybe this be on the next steering committee agenda for us to talk about that. Because the other thing I hear you saying, Jed, is that in terms of interest within the task force itself in promoting considerations of racial equity, I think most of us thought it's great that the county was becoming a member of GARE, then we could all be working together on this. But what I heard you say was we're on our own for promoting that within the task force's work, so I think we just ought to go ahead and do that.
Yeah, well, yeah, I don't want to give the mistaken impression that the GARE program doesn't have something to offer, but it will be those sort of toolkits and those things. I don't think there are opportunities for example, citizens, members of the public here to attend a GARE conference, right, or a GARE training. But those trainings and those tools or those support might come from elsewhere. I'd be happy to share any of the toolkits and all that. But as Dan was saying, it might just seem like it's a land acknowledgement that you begin a meeting with, and then you don't take and carry through with in your actions, right? And so that's something that's one of the reasons why we put that as something we're hiring for to improve on. So
I think Barry's got your hand up.
Yeah, I think that's a great idea. We will put an agenda item on this next steering committee meeting for a GARE implementation strategy. Does that sound okay to everybody?
Yeah, and it does to me. And thank you, Dan, for pushing that a little bit.
Yeah. Thanks, Dan.
Any other questions for Jed on the county implementation of its GARE membership at this time? Okay, well then I just want to thank you for joining us. I know you're busy. We appreciate you being here and answering these questions and helping us out with this.
Yeah, I appreciate the being invited to be accountable for that, and hopefully, in a couple months, or if you invite us back, we'll have even better answers and we'll be further along in the process. So,
thank you, Jed.
All right, we have an extra agenda item that I'm going to turn some time over to Jill Nixon regarding, I believe the topic is task force communications.
Thank you, Jack. I just wanted to let everyone know I received notice this morning that the request for proposals for the IPRTF communications consultant will be advertised this Wednesday, so day after tomorrow. If any of you have ideas for potential contractors who you would want to see put in a proposal, please, by the end of the day today, send me their name and contact information. That would be really great. Proposals will likely be due either March 2nd or March 9th. Jack, Stephen, and Barry, if you have time to stay after the meeting today to finalize some timelines, that would be helpful. If anyone on the task force is interested in being in the group that will review the submissions, also please let me know within the next few days. That would be very helpful. That's it. Thanks, everyone.
Thanks, Jill. And particularly for the benefit of Jason, Ryan, and Jen, we typically at most meetings do committee updates from our subcommittees. And like we said, Ryan and Jen, that's a really good time if you have questions on specific topics for those chair people for those topics. Feel free to ask questions. That is generally a really good time to do that. And Stephen, you want to? Well, how about I'll do steering committee, and then we just go back and forth, whatever you want to do. I'll start with. It's not real hard. We just look for people with their hands up and call on the chair people. So, Barry, would you like to give us the steering committee update, please?
Yeah, there's not much more to offer other than what's been covered by the discussion we had on the Justice Project. That took up the majority of our steering committee meeting. We looked at what items that we wanted to have on today's task force meeting, and we've already covered those. So Stephen and Jack, if you have anything else to offer, I know I got myself really enveloped in the Justice Project piece of this, so I may have forgotten a small detail or something.
No, I don't think so. And let's give ourselves a pat on the back. We used to do the committee updates at the top of the meeting. We moved it to the bottom for this very reason, with the hope that most of the meeting would address many of the issues. So I'm glad that's successful. And I don't know, did we even acknowledge it was Valentine's Day? You know, if we were like in 4th grade, we could all be handing little cards to each other. I couldn't figure out a way to do it virtually. That'd have been, especially if you got sugar with it. But anyway, happy Valentine's Day, everyone. Stephen?
Thanks. The next report is from the Crisis Stabilization Center Committee, and that would come from Perry.
Morning again, Perry Mowry, Human Services Supervisor, and I stepped into chairing the subcommittee for the Crisis Stabilization Center at the retirement of my supervisor, Ann Deacon. We decided that just given that the facility had been established and opened January 2021, that the subcommittee would meet quarterly. At this point in time, and so our our last meeting was actually on the 20th of January. We were focused predominantly on census at the facility, proviso funding update, and then also there's a mural project that is occurring for many areas, sections within the Crisis Stabilization Center. For folks that don't know, our Crisis Stabilization Center is 2 16-bed units. The services that are provided there are withdrawal management for substances, as well as mental health stabilization. Pioneer Human Services is the provider that provides the detox services, and Compass Health is the behavioral health agency that provides the mental health stabilization. We really focused a lot on census. Census has actually been pretty good utilization of available beds for the detox side of the facility. And the mental health stabilization side has struggled to some extent. There's been a variety of reasons in that regard, including workforce gap and challenges. But also that census is really, it's come to just the awareness and continuing to work with the providers that the protocol and procedure in terms of admission to that level of care is pretty extensive and is inhibitive in terms of a quick admission process. And so I'll elaborate on that a little bit more of kind of the steps that we were taking, but that was the orientation towards that. And let's see. So what we're doing at this point in time is we do have a Crisis Stabilization Center Advisory Committee. That advisory committee is made up of law enforcement, first responders, providers, and specialists also from behavioral health specialist orientation. And we actually meet once per month. And the agenda is really set up so that first responders to providers can bring specific issues to the table that can be reviewed and sort of processed and further elaborated on by anybody at the table. I think that it's a really important meeting because it keeps the communication open with law enforcement, and there's great representation there, as well as first responders, good representation there. We also will review, there is a systems improvement form that we established and put online. It's on the county website that any individual in the community can complete. And once it's submitted, I actually automatically receive a copy, as well as Jackie Mitchell. We follow those forms up with the individual that has submitted the form, as well as then linking in the related provider to that service and follow that information up. We ask in the form that there's no private health information that's included, but there's enough information that if it happened on Saturday, that that we know just enough for the individual that if there was a challenge or a problem, of being able to follow that up and understand why that was occurring. So the other piece that I am doing is that we have what I've referred to as developmental meetings subcommittees, and that includes the providers individually to look at the goals that we're working on, and then talk very specifically about steps and actions that are occurring there. At this point, I'm meeting once every couple of weeks with Mike Hilly and Pioneer Human Services, and have also set up meetings with Compass Health to work with them in terms of some of these challenges. What we're working on really comes back to streamlining the process of drop off for first responders and law enforcement. Specifically, and I think we've really made some headway there, particularly with the detox the side of the house, and also have had extensive discussions and conversations with Compass Health just in regard to streamlining that process. They have put together 2 teams within Compass Health, one to take a very close look at the admission process and the challenges that sort of hold up that streamlining that process. And they actually are going to bring back some specific steps and actions that have been taken to our next advisory committee meeting, which will happen in early March. And also to meet and communicate just in regards to another process that is going on, and that is obtaining certification for 12-hour law enforcement drop-off. This is something that was designed and intended by the task force at the onset of establishing the Crisis Stabilization Center, that the facility would be certified for 12-hour law enforcement holds. And so obviously, as we're talking about the process of drop-off by law enforcement in this given situation, and first responders, and experiencing some challenges there just in the time that it takes, and the individuals that are excluded from being admitted, that is a significant issue. And so they have a team, they being Compass Health, has a team that is pursuing this certification with Department of Health. And there is proviso dollars that are available for that project. And also if there are additional costs that come up relative to that 12-hour police officer hold aspect, that there's funding that is available for that. If anybody wants that detail, the 12-hour law enforcement hold is related to RCW 1031-110. And I also have engaged or reached out and communicated with Prosecutor Ritchie, as his office has an involvement too, of identifying the individuals that would meet criteria to be considered for being diverted from arrest to this 12-hour law enforcement hold for the Crisis Stabilization Center. Lastly, we actually had a virtual tour of the Crisis Stabilization Center this last Friday. City of Kirkland made contact with us, had heard that we have a well-established and developing Crisis Stabilization Center process, and were interested, their city council and other members of that group were interested in having a tour and a question and answer. The providers were really leading that process, although I did initiate it and give an overall description of the Crisis Stabilization Center establishing, and and et cetera. It was really great work, and got a lot of feedback from the individuals that had attended from City of Kirkland just in regard to the work that we're doing, and with lots of interest. So I have that information to offer at this point. There are questions?
Chief Tank.
Sure, thanks, Perry. My question is, has there been any conversation with regard to the fire service being able to drop off individuals at the Crisis Stabilization Center? And also, when I did my tour there on the mental health side, the director informed me that they also have the capacity to house individuals that have been in a domestic abuse situation for a night or two, and that hadn't been widely distributed. So any update on that?
As far as individuals that are involved in, EMS and fire, absolutely, there have been some significant steps in that communication in terms of admission. For example, I won't go into a lot of detail, but for example, the real goal here is that oftentimes the individuals actually meet criteria for admission, but it necessitates holding on to the first responder for a period of time to gather information about the individual for admission. And initially that was really became a challenge because of the thought process and idea, if we can't admit the individual, then they possibly need to be, transported to the hospital or something of that nature. And so we've really worked through that process and said that we need to and have begun to develop alternative transportation for individuals, because obviously law enforcement and first responders are a very expensive form of transportation, and we don't need to hold on to individuals in that regard. We also really sort of narrowed that process down to communicating as simply as possible to law enforcement just in regards to who would be excluded from admission to the process. For an example, an individual that's on oxygen, and not, a law enforcement personnel wouldn't necessarily know that you have to be licensed as a facility to have somebody with an oxygen tank, and the Crisis Stabilization Center isn't, just as one example. So I think that process is moving forward really effectively. I'm looking forward to our next couple of sets of meetings in terms of the report from the Crisis Stabilization Unit as well, just in regards to that streamlining process and goal of a 10-minute drop-off for law enforcement and first responders. And Chief Tanksley, I can't really I can't specifically respond to your second question relative to domestic violence and that being a specific component. Possibly, if you would be so willing, I know that you have my email address, that you might email me just as a tickler to reach out to the staff. So I don't want to answer, not really knowing the depth of that question, and I don't want to answer inaccurately. Thank you.
Dan, I want to get to you in a moment, but Mike Hilly, you've been implicated in a lot of these discussions that Perry was reporting on. I just wanted to offer you an opportunity to add to or expand on any of the content that Perry's passed along to us.
Yeah, no, thank you very much. Mike Hilly, Emergency Medical Services Manager for the county. And yeah, Perry's very accurate in the presentation of some of the challenges that are going on with diverting from EMS into the field. And the primary problems is just figuring out that entry point and then verifying that person could be over there. And that's related to transportation and communications at the moment. I do feel like we're getting closer. And the partners over at Pioneer Human Services in particular have been super collaborative on trying to figure this out, and a few solutions that may come up in this in the next few weeks on how to more quickly get people enrolled in the facility, et cetera. But no, Perry's got a great overview, and we're working to try to get that 10-minute drop off. That's our goal for EMS and law enforcement, get that 10-minute drop off, and then have those patients navigated once they're in the facility.
Great, thank you, Mike. Dan.
Perry, how does it work with co-occurring? So if a person's got a mental health illness and a substance use disorder issue. They can't be in both facility, both sides of the facility at once. How does that work?
A great question, Dan, because it actually came up in part of our discussions and challenges. We talked with Deputy Clicks, as a matter of fact, and said, hey, when I call the Crisis Stabilization Center, the phone routing system says, if you want detox, press this number. And if you want mental health stabilization, press that number. And I'm not a trained mental health individual. I don't know what the individual needs, and I can't really make that determination. So we brought that back to the Crisis Stabilization Center Advisory Committee, as well as our developmental subcommittees that meet a little more often. And really determined there was two options. One was to sort of revamp the phone system, which is really challenging. I've got 2 providers and 2 different sets of licensure and some real requirements there of keeping some separation, in that regard. And what we ended up, continuing to work through is oftentimes Compass Health and Pioneer Human Services will work very, very closely as an individual is admitted, whether self-referred or however they come in. And the determination, once the individual has maybe gone through a process of partial detox, is really establishing that they have some pretty significant mental health needs and possibly medication and that sort of thing, which is something that Compass Health can do. And they will literally transfer the individual at that point in time from one level or one type of care to another type of care. And with a release of information that is perfectly acceptable, and they've worked out their internal process for that. So that can even happen at the point of admission, whereas an individual has come in, it's like, don't worry about it. You don't need to make a decision. We'll begin the intake. And as we are processing through that intake, we determine that the individual needs care with the other side of the unit. That process is seamless, and the providers will take care of that process. It was the cleanest way to be able to approach admissions.
Ryan.
Thank you. Yeah, I was just interested on how the volume has been for the last, really since the whole program is opened. And then how would the Behavioral Health Committee go about acquiring some of the information that's been gathered?
Let's see. But certainly it's available. I'll probably the best way to approach that information is to communicate with me, and be more than happy to. I mean, obviously Jill has my email address, and so we could, certainly start in that way. We put together some data information that we wanted to collect, and actually implemented that data collection in May of 2021. And so we have information in regard to from the separate providers based on referrals, admissions, leaving against program advice, those kinds of components, and sort of broken down that way. I had help with Jeremy Morton from EMS in putting together a workbook because I'm Excel challenged. But the workbook will actually show summary information, just in terms of over that period of time or whatever period of time is chosen. So the workbook itself has the ability just to go to a summary page and look at utilization. I will offer that I'm cautious in regard to, for myself, just saying that I'm cautious in terms of managing from a spreadsheet, because data doesn't necessarily answer all the questions. It can certainly bring up important questions. And so that's actually been really helpful for me. Again, as I mentioned, in some given situations, we've had workforce challenges of where they didn't have staff and could not admit individuals, or there have been some certain situations of where there's been a COVID an individual that was admitted that showed negative at their initial admission and then showed positive later. And so the program discontinued admissions for a period of time until they could, obviously address that piece. Okay. So there's some reasons that some of that happens,
Okay, sounds good. Thank you.
More than happy to provide you that information, Ryan, and welcome.
Thank you. Yeah, I'll send you an email after this meeting.
Great report, Perry. Thank you very much. Jack, what are we doing here? Are we switching back and forth?
Behavioral health, legal and justice, and index. So I think we just moved right to behavioral health.
I guess that's me.
That is you and Mike. Dan.
Yeah, I don't see Mike on the call anymore, so I'll do my best. We met on January 18th, and we had a couple of agenda items. But basically we talked about methamphetamine and carfentanil and benzodiazepines for almost the entire time. There's a lot of really good information that was exchanged there. So basically what the concerns were is the new P2P meth, it's a non-ephedrine based methamphetamine. It's a cartel drug. It's not a bathtub drug like the old one was. It causes hallucinations and psychosis upon first use. So it's very, very disconcerting. And on the other side, the carfentanil, which is the new fentanyl, and the benzodiazepine mix are sold. They're called hulkies or school buses in common parlance on the street. And they you can't Narcan out a benzodiazepine. It just doesn't work. And so what happens is that we're seeing more sickness basically, and sometimes overdoses. And I think Hilly can probably speak to that a little bit. I think he was able to get Whatcom to start reporting on overdose deaths. State of Washington has a number of different counties that report on overdose deaths for different types of drug use. And now we'll start to have that data. So that's a good thing. So it's just really disconcerting that that we're seeing these new types of drugs. Under Sheriff Chadwick helped provide an explanation that, basically that these drug trends change over time, and they are working towards treating, pardon me, to interventions and treatment at the county level. And I know that he's working on a co-responder model that's kind of similar to the ART that the city wants to do. We talked about LEAD and GRACE and how those programs have interplay with drug use. I have concerns around drug court, and especially around the Blake decision in terms of having leverage essentially on getting people treatment that they need. And so that's and then ITA's Involuntary Treatment Act as well, and how that all works. So just a lot of there's just a lot going on, I think, with the pandemic, and people's I think if they were close to the edge, they just tipped over, and we're just seeing more of that now. And I think some of it's going underreported, but it's really concerning on the substance use disorder side of the house. We will be having an upcoming meeting to discuss reentry services with the Legal and Justice Systems Committee, and I'm really anxious to see what that looks like. And people coming out of jail need to have like a handhold, basically, whether that's employment or housing or both, or a sense of community. And so we'll be having that discussion coming up. I think that's in March with the joint committee. That's with Raylene and Arlene Feld's committee. So that's in a report.
Thank you, Dan. Are there questions for Dan on behavioral health committee work? Okay. Raylene, I don't see Arlene on, so this is up to you.
Thank you, Stephen. It appears she's MIA today. The Legal and Justice Committee has been discussing jail use, reentry, and competency and restoration. Wendy Jones, Chief Jones, reported on current jail use. And she brought up a chart that showed we have 204 pretrial felonies incarcerated right now, which is a little bit disturbing. A lot of that is due to COVID, but she also reported that this is including a high level of offenders. There's restrictions due to COVID. There's restrictions due to the current situation with the elevators at the jail. So there's a lot of issues with booking people, booking restrictions. She noted that a lot of property crimes aren't being housed. A lot of misdemeanors aren't being housed. This is a high level of offenders, the highest she's ever seen, which is quite disturbing. Also, Jackie Mitchell asked about the acuity, and she also commented that there's more mental health issues in the jail than we've ever had before. So those are concerns that we definitely want to address. Jackie Mitchell also talked about reentry services and that there's mental health professionals working in the jail currently. So that was a positive note on getting some reentry stuff going that was delayed. There is still a need for a juvenile specialist that needs to be hired yet. And she said that's a little bit of a struggle because they don't have individuals in that area at this time. And we definitely want to make sure that that happens for juveniles as well as adults for reentry. We talked about a lot of competency and restoration. And we're hoping at the next joint meeting, we will be joined by individuals from DSHS in competency and restoration, trying to close some of the gaps that we currently have, getting people into beds quicker. And Maya commented on that she believes Western State Hospital needs to admit patients more quickly. And that is definitely a concern. They said that they were hoping to make those changes, but COVID has also put a damper on them being able to receive certain individuals. So we'll be meeting with them. We'll be discussing re-entry and competency and restoration at the next joint meeting in March. And welcome to anybody. Is there any questions in reference to these items?
Thank you very much, Raylene. So I think the last subcommittee report would come from Caleb for index, if there's anything.
Over here. I see.
That's a lot of people to say.
No, it's fair. It's all fair. Hey, sorry, I didn't introduce myself earlier. My name is Caleb Erickson. I work for the Sheriff's Office in the Corrections Bureau as a lieutenant. And I am the chair of the Information Needs and Data Exchange or Index Committee, subcommittee of the task force. We met last week, I think. Time sort of flies by and all sorts of things have happened. We did a lot of recap. We've had a lot of traction lost as a result of COVID. So we did another quick recap of some of the work that we've done, and I'll ask you to bear with me momentarily for some of the folks who are new to get kind of an idea of what Index has been about. We did a lot of good work prior to COVID where we were focused on getting information into the hands of some of our stakeholders and policymakers early on in the process. And Index identified some needs from the city of Bellingham and some of the other cities in terms of information the courts needed. We identified information that we thought could be more transparent in terms of who we're holding and incarcerating in the jail facilities. And so we did a complete overhaul of the website that the county provides to the public so that there's a bit more transparency in terms of who's in custody. And those were huge sort of heavy lifts. And I think that they've gone a long way to help make that information available and provide that transparency. There were a lot of littler things similar to those efforts, but more in terms of identifying things that could be generated in reports, and reports are ongoing now with some of the partners that we have in the criminal justice system. So we have weekly reports. There are more ad hoc reports that are made available, and the Chief Jones is making information available about who's in custody at a given point every week. And so that information has been ongoing. And so as a result of that, we started to get to know the information that's available to us in the criminal justice system. And it's fairly typical. The more you know you don't know. And so we realized fairly quickly that there's a lot more information that's available, but isn't quite at our fingertips. And we needed to identify who had what information, how we could kind of gather that information and use it as a better tool to analyze it. So this last week, we talked about three kind of components that we need in order to make this work. We would need some sort of an infrastructure. So physical component, hardware, some software that would gather information, right? And just simple terms, I'm going out and gathering information from different stakeholders within the criminal justice system and put it together in one repository or some holding space. And then we need somebody who has some critical eye on that and says, okay, well, what does this all mean, right? Understands the interplay of the different data points and understands what that means in terms of projections, because we want to be able to, as part of Index, help inform the policymakers and the decision makers in our community, say, hey, this is something we found to be effective. This is something we found not to be effective. And based on the results and on the data, make positive changes that will help reduce our recidivism rates, help overall in the behavioral health and other components of our criminal justice system. So that's the direction we've been sort of headed, and we've been asking for some assistance and partnership from the county to get those kind of three core components I just mentioned sort of underwritten and underway. But in the meantime, we're going to do what we can to get a hold of some information we know we have our hands on right now. As a county, because I'm a county employee, we have information that is stored in our records management system for the sheriff's office that can specifically identify individuals who are in custody. We can talk about the calls of service that we have. We want to try and focus on demographic information. There's two reasons for that. Number one, we want to talk about things in light of racial equity. We want to make sure that what we're doing, in fact, represents what our hopes would be for our community, that we're not, putting people in jail, or there are no disparities in terms of who we're putting into jail on a demographic basis. We're also looking for the complexity of the circumstances is often more challenging than people realize. I get questions all the time. Well, how many felons do you have in custody? And that's a simple thing to ask. It's a difficult thing to answer because so many people who are in custody have more than one offense holding them. And so when you have co-occurring offenses, some of them are sentenced, some of them are pretrial. How do you categorize those folks? And so it becomes a bit more challenging when you have to look at things through that lens. So if we take another step back, we're looking at sort of 5 or 6 categories of questions that we're trying to answer. And we think that they're at least first steps in helping the key decision-making folks move forward in a positive direction. I didn't write them all down because they're in my notes somewhere else, but essentially we want to know who's asking for help in our community, regardless of the jurisdiction, regardless of the uniform, regardless of the municipality, sheriff's office, what have you, who's asking for help and what kinds of calls of service are we getting out there. We want to look at what situations are going to warrant. So what is the efficacy of our cite and release program? Cite and release meaning that you have a law enforcement contact, somebody's given a summons to appear in court later, and then they're released into the community. They never actually have a custodial arrest. They don't come to a facility at all. But we don't know how effective that is if we're not looking at how, what's the incidence that those go to warrant versus whether they go all the way through to the end. How many of those people ultimately end up in the facility versus staying out of custody. And so trying to get a grasp of how many the actual qualification or the quantity of those interactions and what they might mean for the rest of the system. And as I mentioned before, we're looking at demographic information for all of the people who are in custody. We've been trying to do our best to warehouse that information so that it should be available. And so we've got some historical data and we would like to be able to publish, say, okay, look, for the last quarter, this is who we've had in custody. This is for the last year, this is who we've had in custody, and make that information a little bit more consumable and put it out on the website. So again, there were more buckets, but I forgot to bring them to this meeting and I've got them written down in another note place. We're also working with, so the information needs gathering stuff really led us to the prosecutor's office, the courts, EMS and fire. And EMS and Fire has Gelada information, which is a records management system. The courts have some consolidated information under the AOC or Administrative Office of the Courts, but the courts of limited jurisdiction are going through a process of consolidating their data under Tyler Technologies Odyssey product, but the outlook for our communities in 2024. We don't feel that that is fast enough, I think, for us to be reactive or be ready at least to make good decisions on these issues. And the prosecutor's office is underway as we speak, selecting a vendor for a records management system. But a lot of our jurisdictions deal with paper only, or the majority of their systems are paper only. And so it's difficult to gather data points when we recognize that we can't just get can't grab a field out of a database if we're just looking for a piece of paper somewhere. So those are the broad brushstrokes, and I kind of rushed through it. So hopefully, if you have any questions, jump in here if it makes sense at some point. Darlene.
That was an incredibly comprehensive and clearly articulated summary of Index's work, and it sounds like you've really reactivated that group just in time to start working with Dr. Harris on the SAC data as well. Thank you.
Thanks,
Darlene, I see your hand up.
I just wanted to thank Caleb for all the work that he did. Even just the jail website, the fact now that you can drill down and see when a defendant is in custody and see if they have bail, there's a much more information, and it's probably cut our calls in half for people that have somebody arrested and just want to know what's going on, how they can find out that information. So I just wanted to thank you, Caleb. It's been so helpful for our court, and the collaborative approach you've taken has just really meant a lot. So thank you for that, and we look forward to more in the future, but it's really been helpful so far.
Excellent, Darlene. Thank you.
Raylene.
Thank you for your report, Caleb. And I forgot to mention something that Wendy had discussed in the legal justice meeting, which was Senate Bill 5664. I went ahead and sent that to Jill, who sent that out to everybody. But this is something that we will probably be discussing at the next meeting. This bill, the way it's created currently, appears that we're going to have more mentally ill people in custody in the future if this goes through, due to the way it's written. So I encourage all of you to review that, and those that are going to participate in the next meeting to have a grasp on that, so we can discuss if there's something more that we need to do as a task force. Sorry about the interruption on that, Caleb, but I thought it was important to bring that up.
Thank you, Raylene. And Dan.
Hey, Raylene, can you maybe just give us like the highlight in terms of why that we're going to see more people with mental health illness in custody because of that bill?
I haven't really grasped the entire thing, but little parts of it is that they're going to have people out of custody for restoration. And if they don't comply and take the drugs as they're being monitored as needed, and they decline in their mental health, then there's going to be an order for law enforcement to pick them up. And they can put them into crisis stabilization units, but we don't have enough facilities to restoration and crisis units to be able to put them there. And so there's a lot of individuals that won't be following the orders. As we know, a lot of us don't even take our personal medication that doesn't have to do with mental health issues, let alone taking mental health drugs. I know people, a lot of times when they have bipolar, they feel good, so they stop taking their medication, and then they decline. And then we see a repeat of those issues. I'm not a mental health professional by any means. I've just seen certain things, and maybe Caleb can touch on this, but individuals are going to be released and they're going to be somewhat monitored, but I feel that they're going to fall off the wagon, and then the police are going to be ordered to take them into custody, and we don't have the facilities for that.
One of the things that comes up in this discussion is Whatcom County Jail specifically is one of the only places in the county that doesn't turn away people. So while you don't necessarily have, automatic entrance into one of the restorations facilities in our community, you have to be able to be booked into a facility like ours. We're not booking people because of their mental illness, but oftentimes their mental illness is associated with some form of crime that they've committed or alleged to have committed, and they end up in Whatcom County Jail. It is a sad state of affairs, but that is kind of where we're at in our community. We talked in the meeting last week about, if we had a magic wand, what would we do? And I personally, this is just the world according to Caleb, would advocate that we recognize that this is where we're at as a community. It would be nice to say, oh, we need some other facility that meets this particular need. But the reality of our laws, the reality of our current situation is that we should look at the reality of having to hold people in a facility where they don't necessarily, right now, it doesn't benefit their mental health to have them in Whatcom County Jail. It doesn't benefit their particular needs. And it also at this current moment makes it worse for them, especially if they have to be housed in a cell by themselves or in a place where they can't hurt themselves or others. And so our facility is contributing to the problem in and of itself. And if we want to recognize going forward that, any effort that we want to make towards benefiting this population needs to be considered when the reality is right now they end up in jail, we can't turn them away. So I would advocate that we look at a facility that recognizes that issue and takes it on rather than trying to go around it.
Other questions for Caleb? Okay, good information, Caleb. Thank you so much.
All right, I think we have no other business that I'm aware of. So I believe we have concluded the regular business of the task force. Stephen, you're not aware of any other business, are you? Is anyone aware of any?
I'm not, Jack, thanks.
All right. So Jill, if I could turn this over to you for public comment, please.
Yes, we have a number of people in our attendee list today. If any of you would like to speak to the task force, please virtually raise your hand now. No hands are raised. And again, if Stephen, Jack, and Barry can stay after, that would be great. Thank you.
Okay, well then I just want to thank the members of the public for those folks who are here participating, including I see some familiar county names. We appreciate your interest in our work. With that then, I'll repeat, happy Valentine's Day to everyone, and we are adjourned.
Bye, everyone.